Hello, boys and girls. Hope you are doing well. It's Alex, your favorite nurse, coming right back at you with another video about hair loss. So basically, today we are going to talk about the two main categories that you can think to approach that are available on the market, and some of them, basically one of them, do have on the short term, do have some pretty good results. So at first, you have to check with your doctor and maybe ask another opinion and a third opinion, and you have to search on the internet. You have to Google it to see what side effects, what are the positive uh, effects, what are the negative side of it, because you have to have almost all the information about what procedure do you want to take or what treatment do you want to approach. You have to understand, although the doctors, the medical, staff, they are trained to do that, and they're having a lot of knowledge, but you have to also have the information from your external, links like the internet or maybe people they have done those things. It's very good to have information. So remember that information will lead you, to another dimension of your inner self. So don't be afraid that's my center hitting. So basically, there are two main, categories of approaches, like I call them, to maybe have your hair back again. One is the chemical one, it's the drug one, the medication one, and the other one is the surgical one. I'm going to talk about the surgical one first because I did see it, live, and this one have a short, on the short term, it is very, very impressive. I mean, with this modern technology, the surgical approach is very impressive. But for some of us, we cannot. If you have like the alopecia, it's something genetically predisposed. For some of us, it would not work to maintain your hair forever. Some doctors do prescribe, after the surgical, approach, do prescribe the chemical approach, the medication approach. So basically, almost like 80% of the cases, those two, the surgical and the medication approach, go hand in hand. So let me explain you how the procedure works. Generally, you are under anesthesia. At first, the doctor will a good doctor, a good clinic will tell you to make some blood analysis, to see if your hair will still if your hair stop did stop from falling, because it is pretty. Let me tell you guys, I mean, you have to think about it. If you are doing your hair transplant before your alopecia had stopped evolving at the level, you will lose your hair in 2 or 3 years. You will lose your hair because you'll still have, it's like a disease, the alopecia, that you have to stagnate, like you see your father who is bald at the one part, he will not lose so many hairs, and he'll have that bald head with some patches of hair. So that is when, from my point of view and from the doctor's point of view, that is when you will have to consider to make a hair transplant, which will be like 90% successful. It will not cover your whole head, because you have to be realist about that. You do not cover your whole head, but it will give you that look, that look, not that look that you have searching for, but it will give you a look, which maybe will be good for your psychological part. So basically, you are under anesthesia after you have done those blood tests. You are under anesthesia, and the good doctor, will butcher, your skin from the back of the head, because in here the follicular units are less susceptible, to be attacked by the DHT, because some doctors think that the DHT It's the common problem from hair loss. There are some doctors who think that the DHT is not so to blame for hair loss, but it is a fact that you will have to take in account. So basically, the doctor will strip, because the first procedure is called FUT, so follicular unit transplant. Okay, the doctor will strip a part of your skin, which includes healthy, sets of hairs. Will strip from the back of your head here under anesthesia, so it's not like because people ask, I mean, it will do like an anesthesia in my country? Of course, we'll do, because we do not want to feel pain. It's pretty mad sometimes how people ask those things. So under anesthesia, the doctor will strip that part and he will suture back, but you will still have a scar. How ugly is the scar, or how big or how small? That it's a factor that depends of on the doctor ability to to try to strip your hairs and your skin with hairs like an artist. So that is depending of the doctor's skills. So after that, under microscope, maybe, if not under the close under the eye, the doctor or maybe the medical staff, the nurses, are going to cut, the skin, and to separately into follicular units, because a follicular unit can have like 4, 5, maybe 2, maybe 1 hair. So this is a follicular unit. It depends on your genetical makeup. So after that, after the follicular units are detached from the skin, or maybe in the same time another doctor, or maybe the same doctor. It will be nice if it's another doctor, so the procedure will go faster. Will make some incision into your hair to redraw your hairline, maybe to fill up some spaces, some bald spots on your hair, and with an instrument that can insert follicular units, or maybe with the pancet, with the instrument that he can use to insert those hairs into your head. He will do that procedure, and after some 4 or 5 hours, you're all ready to go. You'll have your medication for pain and for infection control, and some shampoo to wash your hair. They will tell you how to do it, how to take care of your hair, and to come back from some, maybe a new procedure back in time, or maybe from some new checkup on your medical condition that you have. Maybe it's not common to have an infection, but it's very good to check back with your doctor. So it is successful, this kind of approach. I mean, the FUT, because in the next video we'll talk about the next procedure, which is almost the same but is less invasive and less susceptible. Sorry, guys, to pain maybe, and to scar, because the scar will still remain. Like I've told you, it's about the doctor's skill, on the operating table. So it's the doctor's skill. So generally speaking, for most of us, if you are young, or maybe if you have lots of hair and the alopecia did stop evolving, a procedure will be able to fill up some small bald spots, but you will not be able to fill your whole scalp. Maybe if you are like in your late 40s and you have still hair on your scalp, on your forehead, sorry, maybe you'll be able to have like 80% of the hair that you have in your 20s. So it is a fact to take in account. But you have to take in account, guys, if you do not have enough hair, or maybe if the alopecia did not stop from evolving, You will lose your hair once again, no matter how hard you will try, to stop from falling. You lose your hair. This is a fact. They do not tell you that, but trust me, you will lose your hair if guys, if the alopecia didn't stop evolving, and if you are having, hormone problems, from inside your body. You will lose your hair, but if you do not have those problems, you will be able to keep your hair. I mean, I have seen people who still have almost 90% of the hair which was implanted on their scalp. So it's a pretty good procedure. But like I told you, the scar will still remain there. It will be hidden by the hair, but the scar will still remain there, and maybe you'll have pain, but small pain. Some of the patient, as I did wrote some reports about that, feel pain, after the procedure, and after some months or maybe years, do feel a small pain when outside maybe it's cold, or maybe the weather change drastically and abruptly. You will feel a little pain. You will feel a little pain, but the procedure, is pretty successful. It will take like 1 year to regrow on your hair. You can search on YouTube, on internet, and you will see basically some example of people who have done those procedure, and some of them they are pretty happy with the results. Maybe you'll ask if I will go for it, in the near future. Well, guys, I do not know. I do not know. I have to consider basically from the financial aspect, because it's not cheap. It's not so cheap, to have that procedure done in my country. It's cheaper in Turkey. You can search on the internet, and they are very good professional there. But maybe I'll like my bald head, and I will wear just a small beard like I have, and this is it, guys. So basically, I hope that you will find this video, pretty interesting. A like, maybe a subscribe. Sorry again for my English, it's getting good day by day. So in the next video we'll talk about another procedure which is less invasive. It's the FUE, follicular unit extraction, and it's less invasive, less painful, and it will heal very fast. But on the other hand, we'll have some problems to discuss there about that procedure, because this procedure, it's like the treatment, like they say to have in these days. So have a nice day. Hope you did enjoy the video. See you guys.